and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. The death toll of Lassa fever has risen to over 40, including one health practitioner who attended to a patient with the fever in Rivers State. It turns out that some cases of Lassa fever, which occurred as far back as August, went unreported and were discovered sometime after they had happened. Lassa fever, a disease caught from the multi-breasted Mammosis natalensis rat, occurs every year in the country. But this episode has a particularly high fatality rate of over 40%. Today, my guest is Dr. Charles Eliku. Dr. Eliku is a consultant clinical microbiologist and infectious diseases physician, as well as the chairman of those committees at the Babcock University and Teaching Hospital in Ogun State. He is also currently leading the infection control team on Lassa fever awareness to the university and their host community. You're welcome to the show, Dr. Eliku.
Thank you for having me.
Lassa fever is supposed to be a lot less virulent than Ebola. But we're talking about a higher death toll. Are we missing something?
Oh, yeah. Well, the first thing I would like to put straight is that it's not that particularly less virulent. That is, if you are to put it on a scale, I would still say maybe on a scale of 7. If Ebola is 10/10, then I'll put Lassa at 7/10.
So yeah. The figure that we're given, 1 to 15%, is a lot lower than 44 that we are talking about, 44, 46% now?
Yeah, because we, in this country in particular, we are yet to learn our lessons. We are yet to put some things in perspective, right from the top down. I mean, from the government and to the very last person on the street. Lassa fever is endemic. That is something that happens every now and then. Is with us, just like if you talk about malaria. Lassa fever is with us in Nigeria and some few other West African countries. Okay, so we already know that, and there have been outbreaks from time to time. So, but right now, wow, maybe some of the activities of man, that as is usually say, activities of man affecting man. A lot of bush burning, and a lot of other activities over there in the jungle. So that's make an escape route for these rats, and then they are coming closer to us.
But we were given a figure of fatality
the fatality rate.
1 to 15 on a normal day. I mean, in the normal circumstance. Yeah. But this is between 43 and 46.
Currently.
What is different about this outbreak? Yeah. Why is it so high?
Well, the first thing is the disease reporting system, which the Honorable Minister of Health also questioned. Okay, so because what is unusual is the fatality that we are getting here. It's not that unusual to us that we are having Lassa fever outbreak. We've had it in the past. It's still endemic. It's still with us. So, but right now, maybe this particular outbreak, the government, there's a kind of a slow response, which the blame cannot be completely put on to the government, okay? Because you have an outbreak, and then when the outbreak occurs, it occurs at various areas in the country, especially in those states.
Is it usually in the north?
Not usually in the north. Like right now, we already have cases spread down to Oyo State.
We're talking of Lagos now.
Yesterday, we are talking of Lagos. So, because it's one country, even when you talk of an epidemic that is of international proportion, because there's global movement, people are so mobile. So how much more for us in the same country? So the way I look at it, and I will want to advise Nigerians, is to see that the whole country is at risk. Because now we begin to talk of 10, 11 states affected. So the whole country is at risk.
Let's try and peg this disease down a bit. Does it occur at a particular time of the year? Is that the way it behaves?
Yeah. Some people are beginning to associate it to those time of the years that that naturally people encourage some activities out in the outdoor activities that encourages the flow of those rats into the indoors. Okay, activities like bush burning and things like that. But these rats, these multi-mammoth rats, already are highly populated in this part of the world. Okay,
and I hear they have a lot of children at once.
Yeah, and that's why they are multi-mammoth. That is, they have quite a number of mammary glands. Okay, so but basically, our hygienic state, both environmental, personal hygiene in our own compound and so on, all this still places us at risk. All this encourages rats, either the multi-mammoth or any other rat for that matter.
Okay, if you look at the screen now, you can see these are cassava chips.
Yeah.
It's a regular activity. This is what people do, you know. It's a livelihood. They dry it up, then they grind it. How do you advise that people who use this as their livelihood should behave now?
First of all, is education. You've got to educate them. Government, through the Federal Ministry of Health, really need to put mechanism in place for the health educators to go to our local governments and reach out to people like this.
Because like it or not, they have to dry those cassava chips.
They have to dry it. It's part of the procedure.
And the rats can get there.
Definitely. Rats will get there. This is an open space for drying of the cassava chips, you know, which is a procedural step before you get the final product, which is food. We all need food. But in the process, we should be aware of activities that can endanger our health. So health education is paramount currently with this current outbreak.
But I'm just wondering if you tell, you know, a regular woman in the village, look, these cassava chips you're spreading here, rats could come there, eat, and in the process deposit fecal matter and urine. And then she asks you, okay, so how do I dry my cassava chips? What would you say?
Well, like I said, if you have our health educators, you know, actually deployed, let them go to where the people are. Let them go to their occupational field. Let them see what is happening. I believe that there will be a way out.
That they will find a way, a middle ground.
Yes.
So you can get your chips dried and at the same time keep the rats away.
And then back to the government, maybe at the local government level, they should be able to find a way of assisting these people. You know, so we should not continue to do things the way we've been doing it in our own local way. We should improve.
This calls for a new thinking.
Innovations, a new thinking. Innovation doesn't have to necessarily come by with millions. But just, okay, this is the problem. If I dry my products this way, I'll endanger my health and that of the whole community. When rats comes playing there, then how else can I do this? You'll find a way out, for sure.
Then there's the issue of our gari, which we love to drink. And you know, students will tell you in the boarding house that if you have not put gari among their provisions, you haven't bought provisions.
At all.
What are we going to tell these students? I know a particular school where they are used to rats nibbling at their feet in the night. And I'm wondering, would this type of rat do such a thing?
Yeah. Well, we know that is the multi-mammoth rats that transfer Ebola and that transfer Lassa fever virus. However, nobody is going to get outside there and you take a rat and turn it around to see
and start examining it.
Examine it. So the blanket statement is that we should be aware of rats right now. So in any household, in any place where you have rats, practically competing with you, either in your kitchen or in your hostel, then something drastic must be done. Especially,
should we tell them to not to take their gari anymore?
Yeah, if their gari is exposed, if you don't know where your gari is coming from, if you go to the market,
we usually don't know where it's coming from.
Yeah, usually
it's just
we
bought
don't
at
know.
the market and then drunk.
Well, maybe for a time like this too, you want to advise people to avoid drinking gari.
That is why, I was talking about the season when these rats are abundant.
Exactly.
We say for a time like this. When is the time going to end? When is it going to be safe to take gari? When is it going to be safe to spread cassava chips outside? When is it going to be safe, just safe from Ebola? From Lassa fever. We keep calling Ebola.
No, for that of spreading gari, I think this kind of health challenge should actually move us further. Okay. We should go away from that practice.
All right.
Since I was born, that's what I used to see in the villages. Why must we continue? In other countries where they also process food from natural produce, they have a better way of doing it. Because once you are processing any material for consumption, then you must take care of the hygienic status of that food product. You want to make sure that this food product is not contaminated. When you have those cassava spread out there on the street, by the roadside at times, when you are driving along some of these villages, you actually see them by the road.
Yes.
So the such product is exposed to multi-infectious organisms.
As well as dust.
As well as dust. And there are a lot of bacteria spores in the dust. So it's just now that we are having an outbreak of Lassa fever virus that we suddenly think that maybe Lassa fever is the only risk. No, we are exposed to multiple of risk.
Would you say that the reporting of Lassa fever this year is better than other years? Because I'm wondering, if Lassa fever has been here all the time and people are just getting to know about it, why didn't they know since? Are people becoming more educated, reporting more, or is it just worse? They say the numbers have come down.
Yeah, actually there have been a drop in terms of the overall reported cases, compared to the previous outbreak. So that is a pointer that maybe people are beginning to be educated about what this Lassa fever is all about and what they can do to prevent it. However, for this current outbreak, the disease reporting system, personally, I want to query that system, and that has to do with healthcare institution. Okay, so we really need to now use this opportunity to educate our healthcare personnel, healthcare institution from private to public, that once you see symptoms that you think is pointing towards Lassa fever, you actually, isolate your patient and then you report. There is a reporting system that every doctor knows. They are all aware of that. So government should put in effort both at the Federal Ministry of Health and at the various state Ministry of Health to make sure that the disease reporting system is tight, is reawakening, and doctors are practicing that.
They used to have what they call this public address system, whereby they go about, and inform people.
Yeah.
Do you think we should revive that?
Yeah, anything goes this time around. We just need to actively talk about it. If we make a quick comparison to the Ebola case, nobody left anything for chance. during the Ebola. So we talked about it. What we are doing now, we're educating the public. The government really need to send out their educators into the communities. And then probably some NGOs too can also come to the aid.
Okay, we have to take a quick break. When we come back from the break, there are so many other things to tackle. Stay with us. When we come back from the break, other questions to tackle about Lassa fever, and time for your calls to come in. And your tweets. If those tweets coming in time, they could be handled on the program. Stay with us.